So today we're talking about some general knee pain. These are some things you can do at home or some things you can do here if you come to therapy. One thing we're going to work on is just a calf stretch. He's going to prop his feet up on the slant board here and just relax 3 for 30 seconds. We'll do 3 of those. If you don't have something like this at home, you can prop your foot up against the wall, kind of dangle your feet off the steps, something like that. And you should feel the stretch right back up in here. Next, we can do a hamstring stretch, where you just prop your foot up. It can be on a stool, on a chair, whatever. If you lean forward, you'll get more of a stretch. You're going to feel that stretch right back in this area. And we'll do 3 for 30 seconds as well. Next, we're going to have a seat in a chair. We're going to work on a quad stretch. You're going to have your feet positioned here, and you're just going to move your body out towards the chair and kind of bend that knee as far as you can to where you feel a good stretch with that. And that will be 3 for 30 seconds as well. So now that we're all stretched out, we're going to be working on some strengthening exercises. While you're sitting there, what you can do is you can do some long arc quads where you're kicking that foot out and squeezing this quad. You're going to hold it for about 2 seconds, and we'll do 2 sets of 10 probably with those. Next, we'll work on some hip flexor strengthening. He's going to do some seated marches while he's sitting there as well, holding it at the top for about a second or 2 and then relaxing. 2 sets of 10 with those. Then we usually progress to some standing exercises. He'll come to the table here where he's standing nice and tall. We're going to work on some glute med strength where he's kicking his leg out to the side, making sure he's not leaning over and compensating. He'll do 20 of those. Nice and easy, controlled, and then we'll do the same similar pattern, and we're going to kick backwards now, squeezing the glute max here. Same thing, making sure you're not leaning forward and compensating, standing nice and tall. When those get easy, you can get a band and put around the ankles to resist. You can buy these at local drugstore or Walmart. They're very inexpensive. Next, we'll do probably some calf raises up on our toes, working on calf strengthening, about 20 of those. And then we'll go back to the chair, and we're going to do some sit to stands, focusing on form here, making sure the feet are even, putting even weight on both knees when you're standing up, controlling it down, not flopping back into the chair. We'll do about 10 to 20 of those. Once those get easier, we're going to progress into some squats. You can hold on to this for now, and then if you feel comfortable, you don't have to hold on to anything. Main thing what you're going to do is making sure that you're going to pretend you're sitting back like you're sitting in a chair. The butt goes back, making sure the knees are not passing the toes forward here. Do about 20 of those. Perfect. We also usually try to progress to some balancing stuff, or when you're walking on uneven ground, we'll put one foot in front of the other. We do that 2 times, 30 seconds, each foot in front. Once that starts getting easier, we will do single leg. All right, perfect. Those are just a couple exercises, and then some things we do here for you in therapy would be, I'm gonna have him lay on his back. And I could use this as what we call a roller. You can use a rolling pin at home. We can work on some soft tissue to the quad, work on that, work on some edema if you have any swelling in the knee. I can have him lay on his side, do the same thing, work on that IT band if maybe that is tight and causing some knee pain. The same thing if he lays on his stomach. Work on the hamstring as well. Back and forth. If he turns back around, another thing we will do here is just making sure we work on range of motion to regain that normal range of motion for you. Nice and easy bend up. He's just relaxing. I'm going to be the one doing all the work here. And that will be with the bending. To straighten it out, what we'll do is give it a little bit of overpressure and kind of push that knee down into the table, work on straightening that knee. And that's all.